Hello everyone! Today, we're at Queenstown. Why are we here? Let's find out.
Hi, my name is Ian and I'm a Year 3 nursing student.
And I'm Yati, a Year 2 nursing student.
And today you're with us here at NHS and you'll be following us on our door-to-door screenings.
We're really glad to have you here today, so let's go!
Ian and Yati are volunteers participating in the NUS Lin School of Medicine's Neighbourhood Health Screening Program. This community-based health screening program is one of the most comprehensive ones here in Singapore. It provides a one-stop shop service, screening residents for chronic diseases, vision, oral health and hearing, cancer, fall risk and mental health. Over the past 11 years, it has served over 5,000 residents in different low-income districts all over Singapore. But Ian and Yati have a more challenging task on their hands. They are off to the rental flats where the majority of unscreened Singaporeans lie. Studies have shown that rental block residents are 4 times less likely to get regular health checks. Only a tenth of them prefer to see a doctor, with the rest relying on themselves or alternative medicine.
Hello. Okay. So Yati, is it very normal for people not to answer?
Yeah, it's quite common for people to not answer the door.
But do you know why?
Sometimes they're not home, but sometimes they just refuse to they just don't really answer so that they don't have to entertain the people.
Oh, okay. Then is there any specific reason why you think they don't want to entertain? Is it because they are scared?
No, as in sometimes in general, so far from experience, some of them are at home but they don't usually want to come because they don't really want to respond to they think that you're insurance selling or all those kind of things. But if you tell them, then they might be receptive. Some of them might show you over also. Yeah.
After knocking on a few doors, Ian and Yati finally find a resident willing to be screened. Let's meet their team.
Alright, before we start, let Yati and I introduce you to our team.
Hi,
I'm Pigeon, Year 2 nursing.
I'm Mark, Year 1 NTU Med.
Okay, so now let's go meet our first resident.
Madam Tana Lechmi is a 75-year-old resident who lives alone in her rental flat. She's very receptive to the team and they were able to give her a comprehensive health check. The home screening usually begins with a health assessment of the patient's vital signs, such as her blood pressure, blood glucose, and heart rate. For many nursing students, NHS is a good training ground to use the basic nursing and communication skills they pick up in the first year of nursing school.
Okay, so Yachi is actually doing the manual blood pressure for the patient right now to just kind of see how well she's doing. So we will do this kind of 3 times to make sure that the values are right.
After taking Madam Thana's blood sugar reading, the team found that the result may require a follow-up.
I have pain. Until you press for a bit longer, okay? Press. So right now we're just measuring her waist circumference and her height and weight so that we can calculate the BMI later.
The comprehensive screening even involves a check on her vision.
Glasses?
No.
No glasses at all.
This one? Cannot see, okay, never mind. So right eye is 6/24 minus 2. So this test, right, is to test your eyes. So when you see, right, got any black color dots when you see?
No.
Any white color spots?
No.
Don't have.
So you can see clearly, everything can see clearly.
Yati, what are you doing now?
We are
Yeah,
just
see, I'll take your
listing
blood
down
pressure one more time.
taking
Okay, so
some
we will take 3 times
medical
today.
history of the patient, profiling. So basically we will ask her about her conditions and what medication she take and everything.
The students start their medical questioning session with Madam Thana to find out her medical problems and risks. They are guided by a detailed NHS questionnaire.
Then you got ever give your your pass motion? You got ever take the sample and give the test?
None.
Never give before. Even in hospital they never take. No. Okay.
Last time, no.
Last night.
Yesterday.
Yesterday night you got take or not?
Yeah.
Yes.
Okay.
How often do you take?
Every night.
Every night. Then after eat chicken rice, you got eat anything else?
No.
Just that. After today, never eat anything.
Yeah.
Okay, can.
I eat chicken rice only.
Chicken rice.
You got fall down before?
Hold on last time only.
Last time when?
Yeah,
Oh,
in the toilet.
in the toilet. Okay, so when did you fall down?
Very long now.
Very long
10
ago.
years.
10 years ago. Okay.
Vegetable, fish, chicken.
What do you like to cook? You say you cook, right?
Yeah, fish curry.
Fish curry. Okay.
Oh, fruit.
You like to
I
eat fruit?
like fruit.
You like.
You know the name of the medicine you're taking?
This one 10.
As health is not just governed by biological factors, the students also conduct social assessments to see if there are issues that may impede Madam Thana from getting proper medical care.
You got any financial assistance? Anyone like help you or any like,
Other than your children, anyone else? You get money from anyone else?
1 month, give 1 month. Little bit different.
From people? Who
My
gives you?
children.
All children?
Other than
children?
government got
Government?
Yeah, government.
Government got
okay.
give. Okay.
No enough lah.
Not enough lah.
Give 75 only.
Oh.
Every month?
Yeah, every month they give. No lah, 3 months one time.
3 months one time.
Okay. Auntie, you know how much your rent is? This house, how much you pay every month?
Pay
Ah.
every month. Pay money 26.
26.
26. Water bill 150, 130 like that.
The house you pay $26.
$26.
The information gleaned is then used to give patient education so the patient can follow the advice given and gain better health.
Something I must go and check if got bleeding or anything because like very easy to so then your eyes also must go for regular checkup. Okay?
After spending almost 3 hours with Madam Thana, it's a wrap. The team passes Madam Thana her health report, gives her some final words of advice on her conditions, and take their leave.
Take your time, you don't rush. Okay? So this one, just be careful so that you don't fall. If you fall, then we'll have more problems. Okay? So this one, I pass to you, you can keep. Then next time anybody asks you, your doctor or whatever asks you, right, or your children come, you can show this to them.
Okay.
Okay? Auntie, you got any question for us? Kita cakap KV kah? Yeah, okay. Very good.
We catch up with Ian and Yati on what they've learned from visiting Madam Thana.
Okay, the experience was actually very good. So I would say all the team members collaborated well to actually do different parts of the health survey and the whole flow. Alright, so nursing students, I think the very good thing about us is that we are trained to see patients very holistically. So not, like I said, not just the medical issues, but we also train to see how their psyche as well as their social issues actually come together to form the person and also affect their illness. Nursing students can offer that perspective to other professionals who might see only certain parts. So we help bring it back to the real issue, which is the patient.
I guess it just reminds me that there's a lot more that I can provide than just basic nursing skills. Like, not just like the medical, clinical aspect, but like they actually have a lot of other problems. Like even if the main concern is actually their conditions, but maybe they have like issues, like social issues that leads to the medical condition. So like, I guess it's a reminder that I shouldn't be focusing so much on like what they are presented with at that point of time, but like to look at everything as a whole. So.
It would up people's perception of nursing because when nurses go out there and give their inputs, right, we are actually heard. In the hospital, we do a lot of administrative work and we do assessments and we give opinions that are very kind of like behind the scene. So when we go out there into the community and we use what we've learned to actually deliver holistic care, people actually see it. And like for example, the first resident we saw just now, she was very shocked to find out that I was a nurse.
This one?
Yes.
Doctor.
Doctor, okay. Actually, he's a nurse.
I think I'm
Ah.
a nurse, not a doctor.
He looked like doctor, right? But he's actually a nurse.
So this brings us to the end of our health screening today.
We hope you enjoyed your time with us and learn a little bit more about what nurses do. Bye!